Thank you. So we'll move on. These are my disclosures. So, for a little bit of background, we all know that 77% of people living with HIV have been treated with antiretroviral therapy. Most use second gen integrase transfer inhibitors based antiretroviral therapy. And as presented before, resistance is rarely observed, and little is known about subtype-specific genetic barriers to resistance and their relation to resistance patterns. So that's why we came up with this idea to estimate the genetic barrier to ENSTI resistance for the most prevalent subtypes and circulating recombinant forms listed there. And the genetic barrier was calculated for the nearest resistance codon as listed in the IAS USA mutation charts from 2025. Among all consensus subtypes and CRF sequences of Integrase from the Los Alamos database. So, as a little bit of context, transitions which are purine to purine or pyrimidine to pyrimidine are classified transitions, which could be A to G or C to T, occur more easily than the transversions that are purine to purine or vice versa, which is A to T or C to G. And the genetic barrier was calculated as the sum of transitions scored as 1, plus the number of transversions scored as 2.5. So we found that in the resistant positions 66, 97, 121, 138, 145, and 55, they all had conserved nucleotide triplets among the different subtypes and CRFs, indicating that there's no difference in the genetic barrier to resistance. However, in this table, we presented the nucleotide differences that were analyzed among the consensus and subtypes and CRFs. And we can see that in the white lines, those related codons present synonymous differences. However, it's not affecting the genetic barrier to resistance. But if we look at the red lines, the mutation 74I, as we almost know, was already present in subtype A6, compared to all the other subtypes that did not present the triplet, which leads to a lower genetic barrier for subtype A6. In relation to the 140 position, we can see that in the selection of 140C and 140S, the subtype B has a lower genetic barrier to resistance in comparison to all other subtypes, but on the reverse, in the selection of mutation 140R, the subtype B has a higher genetic barrier to resistance. So, in conclusion, we analyzed the genetic barriers across different subtypes for all IAS USA listed mutations, and we found notable differences at positions L74 and 140. This finding could indicate potential subtype-related differences in the genetic barrier to resistance against second-gen ENSTIs. For the future research, we want to investigate whether the observed changes have consequences for patterns of resistance for different subtypes and CRFs in real-life cases collected in the Rosetta Global Registry, which, if you scan the QR code, you can go to the database. So I would like to thank you for your attention and acknowledge Leah, who was first author, and all the others, and Anne-Marie as my supervisor. So thank you all for your attention.